Breastfeeding attachment for health workers. Mothers have breastfed their babies throughout time without paying much attention to how the baby was attached to the breast. Babies may not be attached well and still thrive. However, a baby who is deeply attached to the breast will get more milk and make breastfeeding more comfortable. This video will show why good attachment is so important to breastfeeding success and how to help mothers deeply attach the baby to the breast. There is a common misunderstanding that babies get milk by simply sucking on the nipple like a straw. If it's attached only on the nipple, the baby gets very little milk. But when he takes more of the breast in his mouth, milk comes easily. How a mother attaches her baby to the breast is important for the baby's ability to get enough milk and ensure a long-term milk supply. A look inside the baby's mouth will show why. When the baby takes a big mouthful of breast, with the nipple pointed to the roof of the mouth, the nipple reaches a comfortable area deep in the baby's mouth. He uses his lower jaw and tongue to press on the pools of milk beneath the areola, releasing milk easily. Good attachment is the key to breastfeeding success. In contrast, in a shallow attachment, the nipple is centered in the baby's mouth, which is not wide open. The nipple lands under the hard roof of the mouth. As the baby sucks, the nipple gets pinched. This is painful and may injure the nipple. The baby is also unable to access the pools of milk beneath the areola, so cannot get much milk. How can mothers help their babies attach deeply? First, start breastfeeding in the first hours after birth. If left quiet and undisturbed, healthy newborns have instinctive feeding behaviors that help them find the breast and attach well all on their own. This gets breastfeeding off to a good start. Continuing to use this natural position can help the baby attach deeply in the early days and weeks. Next, feed the baby whenever he starts to signal his hunger. Have the mother hold her baby on her chest. This position calms him and stimulates his feeding instincts. Teach her to read her baby's hunger signals. Sucking motions of his lips, bringing a hand to his mouth, and turning his head from side to side. Now is the time to feed her baby before he starts to cry. Then, hold the baby in a way that makes him feel secure and helps him feed most easily. Have the mother bring her baby to her, holding him close, facing and touching her body. The baby's neck should be straight, not twisted, and the ear, shoulder, and hip should be in line. This will make swallowing easier. Many mothers aim the nipple in the middle of the baby's mouth. This is not ideal because the nipple will end up just inside, pressed against the hard roof of the mouth, which is painful and doesn't let the baby feed as well. Instead, align the baby's nose to the nipple. Be patient. Wait for the baby to open his mouth very wide like a yawn. Then bring him quickly onto the breast, leading with his chin. A gentle push from behind the shoulders as the baby takes the breast can deepen the attachment. The baby is drinking well, and breastfeeding is comfortable for the mother. In this second example, as the baby opens very wide, his lower lip is at the base of the areola and the nipple is aimed at the top of his mouth. The baby is attached deeply and drinking well. Large, round breasts can present challenges to deep attachment in young babies. Shaping the breast so it most easily fits into the angle of the baby's mouth can help the baby attach well. Mothers are often worried their baby cannot breathe while feeding. Reassure her that babies' noses are designed for breathing when their nose is in the breast. Also, show her how to pull her baby closer to move his nose away from the breast. How do we tell if the baby is well attached? The baby's mouth should be wide open. More areola is seen above the baby's mouth than below. The baby's chin is touching the breast, and the nose is free. The lower lip is turned outward, though in a well-attached baby, it is usually hidden in the breast. In contrast, this baby has a shallow attachment. She is brought on with the nipple centered in her mouth. The mouth is barely open. An equal amount of areola is seen above and below the mouth. Her chin is off the breast. While her lower lip is turned out, which is a good sign, her cheeks dimple as she sucks, a sign of shallow attachment. If the baby is not well attached, gently take the baby off the breast by putting a clean finger in the corner of her mouth to break the suction. Notice the nipple is pointed from being pinched. Assure mothers that with time and practice, attaching the baby well will get easier and more automatic. By 4 to 6 weeks, the baby's head and neck control also helps them to deepen attachment on their own. Look to see if the baby is drinking well. The baby's jaw will drop distinctly as he swallows. The baby who is not getting much milk will have a continuous fast sucking pattern without pauses. Ask the mother how it feels. Breastfeeding should be comfortable, except for temporary tenderness in the first few days. She should not feel pinching, pulling, or rubbing on her nipple. If it is painful, the baby is probably not well attached. Shallow attachment can lead to less and less milk being produced by the breasts. At this point, worried mothers often start to give their babies other food. As the baby fills up on other food, he won't need as much from the breast. As he sucks less and less, the mother's milk supply will decrease. Breast milk is the best nutrition for the baby. Be sure every mother in your care learns how to attach her baby well to her breast. This will lead to good sucking and plenty of breast milk and no need to give the baby any other food in the first 6 months of life. Remember, breastfeeding should be comfortable. The baby feeds from the breast, not the nipple. A well-attached baby will make more milk come.